maybe I'll give you just a couple examples of genes that or of stories of ours that have already led to FDA approvals, and in fact, in some cases, blockbusters already, that really show that this process really makes a difference and can make a difference for large numbers of people. And I want to first focus on the first approval was our first approval in 2008. It was for a rare disease. I want to focus on the next one, which had to do with a phenomenal story where we once again went from human genes to an important drug for people in relatively, I mean, it took 10, 15 years, but in this business, that was actually pretty impressive, pretty direct. And in this particular case, basically, we started with these X-men who were protected from heart attacks. And basically, we modeled it in mice, and we created mice that were protected from heart attacks. And then we created a human antibody in one of these human mice that mimicked this protective mutation. We started testing it, and eventually, as we've just announced in the last month or so, we actually showed that we could actually reduce mortality due to cardiovascular disease. We could save about 1 in 3 deaths in the people who were at the highest risks. So this is really a pretty important and exciting finding, and it really validated a hypothesis that using this genetic approach, you could lower the bad cholesterol and result in marked reduction in coronary heart disease and death after less than 3 years of treatment. So this is something, remember, this is still the #1 killer in the United States is heart disease, and now we've shown something that on top of the maximum statin therapy, which is the therapies that have been around for more than 30 years now, we have something that can really make a difference above and beyond that. So the next disease I want to deal with is so-called allergic disease, which I'm sure many of you guys know about. But there's all sorts of allergic diseases ranging from asthma to atopic dermatitis or eczema to allergic rhinitis, to nasal polyps, to eosinophilic esophagitis, and emerging food allergies, which are becoming a bigger and bigger and bigger problem. All sorts of allergic diseases happening all over the world. And once again, we took the same approach. We started with X-men and women, and we found genes that we thought were protective against allergic disease. And moreover, doing a lot of the same work that I just showed you based on mice and so forth, that led us to have a theory that all allergic disease was linked to the same underlying mechanism or pathway that resulted in a specific kind of immune response driven by 2 interleukins, interleukin-4 and interleukin-13. And we've now gone on to have some overwhelmingly positive phase 3 trials in major diseases now. I mean, this is not something that one sees, where one sees improvements in these big diseases where you're seeing 70, 80% improvements in these individuals in both atopic dermatitis and in asthma. And I could go over the data for you, but I just thought I would just show you a couple pictures from one patient. I just was sent this about 2 weeks ago from a treating physician who said, with the family's permission, I'm sending you before and after images of patients with this severe atopic disease. This is this terrible allergic skin disease called atopic dermatitis. We are intended or trying to treat the most severe people. The severe people in this population have more than half their body covered by this oozy, itchy rash. The way they describe it is like having poison ivy over 50% of your body, but it's all the time. It's unrelenting. It never goes away. Imagine how horrible that could be. So this poor little girl, 11-year-old girl, had been treated with everything from systemic steroids and antibiotics and all sorts of creams. Nothing was happening. The family was in crisis. The poor girl was hospitalized for almost 6 months and unable to really function. And she was miserable. And after 3 doses, as you'll see, she's a pistol, as the treating physician says. And they wanted to know how grateful it was they were for our drug, and that this one particular patient has 20 kids on this treatment, all doing incredibly well, and the quality of life has vastly improved, and so has mine. So what does this disease look like? This is the poor girl before treatment. And this just doesn't go away. It really is like having poison ivy over so much of your body. And it's itchy, and it's oozy, it's horrible. It doesn't go away. You take our drug, look at that. And as the physician said, after 3 doses, she's a pistol. So this is why we do, what we do, because I think there's nothing more rewarding for us scientists than to use science to make a difference in people's lives. And I think that maybe I'm getting a sign here that I got 2 minutes left, even though on my screen it says 7, but it's okay. I'll just get to the very end. Okay, I think the whole point of it, I was going to show you a few more great drugs, a few more ways in which how they work. But I think that, the important message is that, as I said, I don't think people understand. I mean, there's all this discussion about healthcare and the cost of healthcare and all that. What we don't appreciate is the cost of disease and what that cost is going to be to society if we don't come up with more treatments, more cures. Okay, and that's what we're not focusing on. That should be the highlight of the discussion. That should be the point. Not, are we going to get universal health care today? Because that's meaningless. Because if we don't do something about this, there'll be no health care for anybody. There'll be no economy in 20 or 30 years. No society can support this amount of disease. So what the conversation should be shifting to is, what are we all doing about addressing some of the most important challenges facing mankind, which are coming up with solutions for all of these diseases. And I think that we've come up with one example of one company that completely revolutionized or changed the way it's done by, I think, focusing on the most obvious, focusing on the DNA, on the genetics, focusing on naturally occurring X-men and women who are either protected or susceptible to disease, and taking advantage of that to come up with new treatments. The hardest thing it is for society to do, new treatments for major diseases that are searching for treatment. So that's pretty much my story. I feel like, in many ways, we're just getting started. I think many of us, not only Len and me, but many of the people who've been on board for 10, 20, even 30 years, like Len and me, I mean, many of us feel we are now only developing the capabilities and the foundational technologies and the resources to really get even more and more powerful at doing this. So we're very excited about what the next 10 to 20 years can bring. So I have a slightly different viewpoint about startup. I just think that people, it's great. I think it's a great experience. It's great what you guys are all involved with. But I do think that one wants to also be thinking about the end game a lot. And I don't think that one should be necessarily always thinking about the end game in the next couple of years, the next few years, the next 5 years, even the next 10 years. It's, what are you going to do with your life? What are you going to do to change the world? What are you going to do to make a difference in society? And I think there's nothing better, I can't imagine anything better, than building something that is going to grow and be sustained and is going to be making a difference in society for decades and decades and decades, which is what I hope that we're doing here. So I don't think it's about, I think the startup phase is important, but I don't think it's about the startup phase. It's, I think, about the sustainability and the continuing delivery of important value to society and to mankind. And when you've done that, then I think maybe you can feel like you've really, made a difference in the world. So with that, if we have time for questions, I'll be glad to take some. No questions. Okay.